Well, we've all heard how important it is to get a good night's rest, but now a connection between women who don't get enough sleep and weight problems. A new study in the Journal of the American Heart Association reveals that lack of sleep can lead to overeating and a diet with more sugar and caffeine. That can ultimately lead to bigger health problems. Dr. Stephen Gradney is a sleep specialist at Mercy Hospital. He's here to break this scenario down for us. So first, thank you so much for being here.
Yeah, pleasure to be here.
Explain that connection between a lack of sleep and our diet.
Absolutely. So as everybody's hearing nowadays, sleep's vitally important to multiple parameters of our health. And what we've noticed and what a lot of studies have shown is that short sleep, less than 7 hours, or poor quality sleep, as was studied in this particular article, leads to hormonal changes. And so what we see is that there's actually increases in hormones that make us hungrier, and there's decreases in hormones that actually make us feel full or satiated. And so that combination of being more hungry and taking more food to make us feel full is actually what leads to overeating, excess calories, and that leads to weight gain and increased cardiovascular disease.
Does this affect women differently than men, or is it about the same?
So this study was particularly in women, so about 500 women with from multiple ethnic backgrounds. And the reason they did that was that, unfortunately, most of the studies in medicine were originally done predominantly in males and predominantly in white males. And so research like this is really important to kind of say, well, does this affect other groups differently? And so to answer your question, women in most of our research are shown to be more prone to gaining weight, more prone to obesity, and so we think that it's just an important population to really kind of dig out all the risk factors that kind of contribute to that. We also know that women are more prone to have shorter sleep periods. Traditionally, that was due to kind of gender roles where they were kind of in charge of caring for the children and in charge of caring for multiple other household chores. And so maybe that's changing today, we don't know. But this study would suggest that they're still, just like everybody else, quite prone to not sleeping enough.
So we know that if you don't get enough sleep, these hormone changes can affect your diet, but can what we're eating also affect how we sleep?
Right, so that's actually been the kind of basis of several studies as well. And the answer is yes. So kind of some of the classic things that would disrupt your sleep are caffeine, obviously. Alcohol, we know, is a big disruptor of sleep. Acidic foods prior to sleep can really cause you to have some reflux and be a big disruptor of sleep for a lot of patients. And so those are kind of the more classic ones. But then there are other things that people have traditionally thought make your sleep better, such as drinking some warm milk or something like that before bedtime. And most of the studies don't really pan out very well for those things. It's a modest effect at best. And then to get kind of even more specific about it, we've done some studies to look at high carbohydrate loads prior to bedtime or high fat loads. And what we've shown in that, again, pretty modest effects. But high carbohydrate loads seem to disrupt your sleep architecture, or kind of how you cycle through the different stages of sleep, whereas in a negative way it affects that. And then in a positive manner, kind of higher fat loads will tend to make the sleep architecture look a little bit better. But again, pretty modest effects, so we don't really recommend anything like that.
And nowadays there are sleep machines and there's fans, weighted blankets even, that might help you get a better night's rest. So do these things actually affect our quality of sleep overnight?
Well, it's difficult to say, right? So there's not much research on most of them, and any research that we do have is really based off of a small number of patients, a limited amount of time of research and evaluation. And so I would say that most of them we can't really say are actually beneficial. If they are, it's modest. But most of them probably don't hurt. And so that's a good thing.
Okay, and if we're just not getting enough sleep at night, how beneficial are naps?
So naps in my clinic anyway, where I see a lot of patients who are sleepy throughout the day or who have trouble sleeping at nighttime, naps are kind of generally something we ask patients to avoid, right? If you have naps during the daytime, it tends to disrupt your nighttime sleep, and that seems to be more of an issue for patients than daytime sleepiness for the most part. However, if a patient's really feeling like they're just overwhelmed with fatigue, overwhelmed with sleepiness, then a 10-minute nap, and that's pretty short, a lot shorter than most people do, but we don't recommend more than 10 minutes because it, again, can disrupt your nighttime sleep. A 10-minute nap, as long as it's before probably 3 p.m., if they're on a normal sleep schedule, can actually be beneficial. But again, kind of limited recommendation.
Don't want to hit that REM sleep in the middle of the
No,
afternoon.
no. Anything longer than that, and you tend to get into what we call a sleep inertia phase. And so the patient can actually be more sleepy when they wake up, at least temporarily.
Any advice for people to get a better night's rest?
Well, a lot
Other
of
than
advice.
everything we just talked about.
So typically what we recommend is a whole regimen of what we call sleep hygiene, a little bit of an odd term for it, but that's just all of the beneficial habits around sleep. So I'm sure most of your viewers have heard most of them, but obviously, as I said, avoiding caffeine, afternoon, avoiding naps. Going to bed at the same time every day really helps entrain a circadian rhythm, and so your body knows kind of when it should be asleep. Waking up at the same time every day, same thing. Avoiding electronics or sources of blue light or sunlight kind of within a few hours of sleep. And then we always encourage patients to work out, but if you work out within probably about 3 hours before bedtime, you're probably still got some activation from that workout, some of that energy that's keeping you awake a little bit longer.
Good to know. Okay, this is Dr. Stephen Gradney. Thank you so much for being here to
thanks for
help
having
us
me.
all get a better night's rest. We
Thank you.
appreciate it. We'll be right back.